Hi, Barbara. How are you?
I'm good. Good morning.
Good morning. Thank you so much for taking the time to come talk to us today. Maybe you would like to introduce yourself before we start getting into our big questions.
Yeah, absolutely. Well, thank you for the opportunity to stop by today and chat. So I'm Barbara Schillo. I'm the Chief Research Officer at the Truth Initiative, which is a national nonprofit public health foundation. Our mission is to prevent addiction among youth and young adults and empower quitting for all. And I lead a team of research investigators that do tobacco control research in a variety of tobacco-related areas, tobacco and media, surveillance, health communications, as well as policy and regulatory. And we've had the opportunity, we've been fortunate to publish in JMIR. Recently in 2024, we had a publication that looked at a social media intervention and the impact on reducing intentions to vaping.
Oh, that's amazing.
Yeah,
That's great. Wonderful. So, as you know, the APHA theme this year is rebuilding trust in public health and science. And we would love to know, how does your work specifically address this theme?
Yeah, I love the theme of this conference. I always love the theme, but I love this one in particular. It is so timely. And I think my research touches on that in particular. So tomorrow, I've got a long title, so I've got my notes here. I'm speaking Tuesday at 10:30 on an ATOD section sponsored presentation on commercial determinants of health. And I'll be speaking specifically to the tobacco industry and their efforts to interfere in our science and how that weakens public health and what we can do about it. And so I'll be talking about the long history of the industry in this area, but really recent examples of how they've been interfering. And ultimately, it's not just about interfering with the science, but it's about opposing the application of that science to proven public health strategies. And so, yeah.
Wow. Okay. That's really nice.
Yeah.
And I'm so glad that, that's the kind of work and research that you're putting out there.
Yeah, I think it's important. We're going to also really try to focus on, well, what can we do about it?
Absolutely.
So not just what the problem is. And a big piece of that for us, I think, is, and I work together, it's not just Truth Initiative. I work with a Tobacco Science Integrity Steering Committee, a group of academics, practitioners, and people across a lot of different organizations that really care about this issue. And we're working to raise awareness, especially among younger generations of practitioners who maybe weren't around during the early years of, the tobacco trials and the settlement dollars. And so raising awareness, but then also really pushing for the adoption of a comprehensive framework for conflict of interest policies.
Right. And, you mentioned use, and I think especially today with the vaping culture that is so prevalent, there's so much information that needs to be put out there, and we need more people to work with policymakers to sort of set out, put out the right kind of information.
Yeah. I'll just add, that's what's so exciting about JMIR. It's really at the intersection of technology and health and digital health. And that's so important for Truth Initiative, because that's where youth and young people spend their time, and that's how we can reach them. Yeah. And so increasingly it becomes a really important area of research for us.
Absolutely. So maybe you've already talked about this a little bit, but what unique challenges and opportunities does your area of research face in terms of public trust?
Well, I think one of the biggest challenges is the proliferation of mis and disinformation. Yeah. And that's really a challenge across all of public health, not just for tobacco control and tobacco research efforts. And so I am really excited for us in public health, but really from an interdisciplinary approach, to think about how do we bring communication scientists, medical professionals, public health practitioners, and the research community together to more intentionally address how we're going to rebuild the trust, how we're going to debunk or pre-bunk the misinformation and the disinformation that gets out there. So I think that's one of the unique challenges, and I see us heading off into some really great new directions in that area.
Absolutely. Okay. Would you maybe be able to share an example from your work where you've had to navigate public skepticism or misinformation?
Absolutely. So I think for many of us in tobacco control, we would point to the FDA proposed ban on menthol cigarettes and little flavored cigars. It was both of those product categories. And so this was proposed in April of 2022 by FDA. So there's strong public health science that supports the public health benefit. We know that it will have a positive and significant public health benefit, especially on those communities, African communities, LGBT communities, those targeted by the industry in terms of menthol products. And we know that there's majority support when you look at public opinion, but yet the industry opposes it. Industry or their affiliates have really worked to create divisive messaging on it and stoke fears that this would criminalize the possession of menthol products in the Black community, which is not at all the intent of the proposed ban. And so then, of course, it's no surprise when you see headlines, Biden's menthol ban splits the African-American community, the faith, the advocacy community. So I think for those of us working in this field, we can definitely point to that and the importance of getting out there, reframing it with the health message and letting people know where those messages are coming from.
It's just about putting the right information out there.
Yeah, absolutely.
How do you think public health professionals can better communicate their scientific findings to build trust within the communities? And I think that's you just spoke about the menthol cigarettes and what they're doing, but maybe you have more insights.
Yeah, well, I was inspired by what Dr. Georges Benjamin said yesterday in the opening session, that trust, really rests on the pillars of truthfulness, authenticity, and character. And, I'll speak to the authenticity piece. I think what, maybe as research, as a scientific community, we've come late to the game, but I think we finally understand and appreciate the importance of listening to, involving communities, and tapping into their expertise in terms of really understanding and framing the questions, framing our research. And so I think part of the process of regaining trust is reframing how we do some of our science. I think that's really critical. And I'm trained as a community psychologist with participatory research methods, and those have always been important. And now I see them really sort of coming into fruition and playing out in action. And so that's encouraging to see.
It's wonderful. Yeah. Okay. What do you think? What are some ways in which research can be made more transparent and accessible to the public?
Yeah, that's a great question, too. I thought about this, and I think JMIR is doing some of that as well as other publications or outlets. And I think it's really looking at alternative formats.
Yeah.
So it's looking at podcasts, even interviews like this, video shorts, plain language requirements. Yeah. I mean, these are all using social media. I often ask my investigators when they've gotten published, I said, give your research a little love on social media, get it out there. Yeah. And so I really encourage the younger generations are thinking about this in ways that maybe those of us that have been at this for a while. So I think that these are just all the different types of vehicles that really make our science more accessible and understandable.
Yeah. Okay, so that's great. And finally, what are you hoping to gain from attending this conference this year?
Well, Minneapolis is my hometown, so I hope everybody leaves with a little affinity and love for Minneapolis and the great state of Minnesota. It's been great to be here, and the energy. I just feel really at a really hard time in our country's history, a divisive time. I feel really supported and lifted up. I love the theme of superheroes, public health superheroes. Yes. We've all, come out of COVID a bit battered and really need that energy, that support from each other, because no matter what the course, there will continue to be challenges. And so I'm really just hoping to connect with all of my colleagues, people I don't see regularly, and just come out of this re-energized and up for the challenges that lie ahead.
That's such a beautiful thought. And thank you so much, Barbara, for taking the time to speak with us today. It's an absolute pleasure.
Thank you, Shruti.
And we hope that, you keep collaborating with like-minded professionals, and you keep, considering JMIR for your work.
Absolutely.
Thank you so much. Yep. Thank you.